As I was saying, RSD has been around for a long time. There is something called the McGill Pain Index, and on that index, RSD is a 42, which makes it the most painful condition known to man at this time. And once again, the year that I'm speaking to you from is 2014. Natural childbirth falls somewhere in the high 30s, very low 40s, and RSD / CRPS is at a solid 42 on the McGill Pain Index. There's no easy way to describe the feeling of RSD outside of a burning, stabbing, throbbing feeling. My RSD presented in my left foot 11 years ago. The only way that I could describe it to my doctors then was that it felt as though a red hot railroad spike was being pounded into my heel from the bottom up. That was the only thing I could relate it to. It was excruciating pain, and I literally felt like my foot was on fire, to the point of trying to dunk my feet in a ice cold tub of water to try to relieve the pain, which of course didn't work. I'm going to keep this journal for as long as I can. I'm going to try to show you what RSD really is, what an RSD attack really looks like, and it's not pretty. Right now, I have a spinal stimulator that was implanted a number of years ago that is no longer effective. The newest thing that they're trying to use to combat this disease is something called a pain pump, which is implanted and filled with a non-narcotic medication. In my case, it will be a snail neurotoxin. That's where we're at now. We're getting ready to do the trial, and the trial will enable my doctor to determine if he thinks that the pump will alleviate the pain that I'm in to the point of coming off the narcotics that have taken away my health, my teeth, my looks, my hair, my personality, virtually everything that I am. My life has become what you're looking at right now. This bedroom is where I spend my time, and this bed is where I spend my time. You can see from the video that I'm surrounded by pillows. These are the pillows that support my legs to keep my feet and legs elevated, and this pile of pillows is to support my head and neck. As I talk to you now, my RSD has spread from my left foot into my right foot, up both legs to thigh level, into my lower back, up my spine. It affects both arms all the way down to my hands, and because of the extensive dental surgery to remove all of my bad teeth, it has now moved into my mouth. The pain in my mouth is just like the pain in the other parts of my body. It is a burning pain, and you can't stop it. RSD can affect children. It affects young people of college age, but its primary victim seems to be women in their 40s, which makes me totally average. The only thing that is not average about my case, I am told, is that because I have been on such a high dose of high-grade narcotics for so long, I have an incredible tolerance to narcotics. So it's very hard to treat me effectively and keep me out of pain. Until 2 weeks ago, I was on a regimen of 60 milligrams of roxicodone 4 times a day. I am told now that that is an illegal dose, that the federal government no longer allows that amount of that particular drug to be dispensed because it has been deemed so dangerous. So the first day I saw the new doctor, he asked me to cut my consumption of the drug down by 50%. And as you can imagine, as with any heroin addict, alcoholic, compulsive gambler, anyone with an addiction, stopping at the 50% mark has been incredibly difficult. You'll see that I have a cigarette in my hand. I am a smoker. Since I have tried to come off of the narcotic, my consumption of cigarettes has gone up 100%. So instead of a 1-pack a day smoker, I am right now a 2-pack a day smoker. In spite of that, after having lost 130 pounds through gastric bypass surgery 3 years ago, since I have tried to cut back on my roxicodone, I have put back on 10 pounds because my mobility is so limited. I do use a wheelchair and have for a number of years when I go shopping. When I go out on family excursions, that will mean that I need to get out and move around for more than just 5 to 10 minutes. And the clock starts ticking as soon as my feet hit the floor and I come out of this bed. I have X number of minutes before I'm down and out. You're going to find that when you see a patient in socks and in a wheelchair, chances are that's an RSD patient. Sometimes even the socks are too painful. Shoes are far too painful. At this point in my life, I can wear Birkenstock sandals. Nothing cute like with the little strap between your toes, because that would be horribly painful. But an open-toed sandal, and I can wear a particular brand of boots in the wintertime. I can wear UGG boots because they are lined and they are wide and they don't fit snugly. And of course, the style that I'm able to wear has no heel to speak of, no high heel to speak of. I was a professional entertainer for more than 20 years, so high heels were a part of my everyday life. Not anymore, not for the past 11 years. Also, I had a career in retail management. I spent my day-to-day life in good quality tennis shoes, and that is no longer a possibility. So whether it is a wedding, a christening, a funeral, or anything in between, I either show up in sandals, Ugg boots, or I don't show up. I hope that this video series is something that will help other people like me. I hope that you'll realize that you're not alone. I hope that you will realize that there are other people that can hold your hand while you're going through this. There is hope. There are leaps and bounds being made in medical technology every day. When I was first diagnosed at the age of 42, the leading cause of death amongst RSD patients was suicide. That's no longer the case. Implanted spinal stimulators came along, and that saved a lot of people, including me. Virtually every RSD patient is put on some sort of antidepressant. That has saved me. RSD also gives you cluster migraines. The medicine for that has certainly saved me. I didn't mean for this video to be this long. I don't expect all of them to be this long. I can only promise you that they're going to be very, very honest. So what you're going to get is the good, the bad, and the ugly. You're not alone. Hang in there. Stick with me, and we're going to make it through this. Have a good evening. God bless.